Some illnesses you don't necessarily feel right away. And man, if you wait too long, it could be a pretty serious issue. If you have heart disease, you might not notice it until you have the heart attack. If you have cancer, you might not realize it till it gets to stage 3 or stage 4. Our next guest has technology to take a look inside the body and catch things super early, which would give you the best prognosis.
That's right. Dr. John Pierce is here. He is the medical director at Preventative Diagnostics, and it is all about prevention. It's all about early diagnosis. Tell us how you are putting the power of people's health in their own hands, doctor.
Well, we're able to do this with a very high definition CT scan. The unique part of our CT scan is it actually keeps the patient in mind as it measures the basically density of the patient and allows us to give the lowest effective dose of radiation to get the most high quality imaging, such that we can see any abnormalities down to about the size of a grain of rice. So this really allows for us to be ahead of the game as far as finding things such as plaques in the coronary arteries, which relate to heart disease or cancer at very early stages. So we allow patients to have that peace of mind getting a scan. If we found something, it's very early. In most cases, fortunately, we find that most people are healthy.
That's good. That's a good thing to know, and it's a nice peace of mind to have as well. I think it almost sounds like science fiction, going into the doctor and getting the full scan, see what's going on everywhere. But this is what happens, and the scan is relatively quick as well. Tell us about the scan.
Well, the scan is only about 20 seconds long. There is no tube per se, so people that are kind of claustrophobic and afraid of being kind of in a tube for a while, 20 seconds, there's almost a donut type shape that kind of you go through, but your head is never really enclosed. So we haven't had anybody that could not tolerate the scan.
Nice.
Yeah, it's super easy. I, in fact, have done it. I know we're going to talk about a recent patient of yours, Jasmine, but I can vouch for the fact that it's very easy. I didn't feel there was nothing uncomfortable. There was nothing scary about going through the scan, and I really appreciated getting my results back quickly and hearing from your professionals. Tell people how people go about finding out their results. It's not just you hand them a report and they have to figure it out.
No, well, in most cases, if the board certified radiologist reads the scan and there's no problems, we will go ahead and send that off to the patient. Now, if there's any abnormalities of concern, that's my job. I give a call to the patient to kind of explain what the results mean and what further follow-up that they should embark upon. Again, we're trying to be proactive, preventative. We find anything abnormal, we want not only for you to know the answer to or kind of what's going on, but then the following steps to go ahead and start to take care of this issue.
Yeah, there are some stories that have come out of preventative diagnostics that, frankly, you're giving people their life back. They didn't realize their life wasn't going to be theirs, but my goodness, I mean, the positive outcomes that have come from a trip to preventative diagnostics. Let's talk about Jasmine and what she found and what you're able to help her find.
Well, Jasmine's a unique case. I mean, she came in because her mother was recently diagnosed with a cancer of female organs, and I believe it was ovarian cancer. And this caused concern for her because there's a genetic, predisposition to many, many cancers. Fortunately, she was one of the cases where her scan came back absolutely normal. Another little side is she has high cholesterol, and her doctor was wanting to start her on a statin medication. But when we found that there were no plaques in the coronary arteries, she felt very comfortable in having the discussion with her doctor that she really did not want to start that statin medication.
Interesting.
Oh,
Nice.
excellent. Yeah, anytime you can keep off medication, it's good. It's good to have that information. You have a special offer. This is like one of the silver linings of COVID is the special offer you're about to tell us about.
Well, yeah, we're offering basically 2 for 1 for a couple, where they can come in and get a coronary artery calcium scoring done along with a heart scan for $125 for the couple, not each.
Wow.
And we usually run that for $599 per
Wow.
individual.
Wow. Okay.
That's
Yeah.
amazing.
That's an awesome deal. And what an opportunity too, because I think a lot of the times you see the spouse is the one that's pushing the other spouse. Hey, go to the doctor, make sure it's okay. Oh, I'm fine. This is just a way to be able to go in and make sure that what's ever going on inside is A-okay. And if not, to address it right away. Doctor,
Certainly.
really cool technology, and it's great having you on as always. Thank you so much
Thanks for joining us.
Thank you for having me.
All right, take advantage of that special offer. Not just for you, but for your boo too. You both go in. You like that? It rhymed. You get a heart scan with a calcium score. This usually runs $599 per person. So for 2 people, quick math, that'll be $1,198. But today, as you watch in the Morning Blend, you give them a call at 534-7900. You're going to get it for $125 for the couple, which is fantastic. pdcenterlv.com if you want to learn more. Preventative Diagnostic Center, a proud sponsor of the Morning Blend.